Hi, my name is Bertrand Dirk, and today we'll be discussing about cluster headaches. Now, according to the Headache International Society, cluster headaches are a rare type of headache. It affects around 0.1% of the population and affects males 5 to 6 times more often than females. Now, although cluster headaches are uncommon, they are regarded as excruciating and the worst type of headache you can experience. Out of the near 300 different headache diagnoses known to date, cluster headaches are the highest recorded pain level. They are commonly referred to as suicide headache. The pain experience is of a severe to extreme nature and has been reported by female sufferers to be worse than the pain of childbirth. Attacks occur in clustered periods or in cyclical patterns that will often awaken you in the middle of the night or at set times during the day. Duration of attacks range between 15 to 180 minutes and may occur anywhere from 8 times per day to once every second day. Bouts of attacks known as cluster periods can last for weeks or several months, followed by weeks, months, or even years of remission, which are headache-free periods. Pain affects one side of the head, most commonly around or behind or above the eye and or the temporal region, and is usually always on the one side. Now, the common signs and symptoms. So those with cluster headaches usually cannot keep still during an attack. They are often try to relieve their pain by pacing around the room, walking back and forth, or sitting down in a hot shower, rocking back and forth, and sometimes hitting their head against the wall until their pain stops. Now, the associated symptoms can include the following, which are severe pain behind or around the affected eye and can radiate around the face, head, and neck region. Pain is usually unilaterally, which means it's only usually on one side. You can experience restlessness, difficulty breathing, redness in the eye, watery and teary eye, runny or congested nose on the same side where the pain is, swelling around that same eye or eyelid, drooping of the eyelid, sweating of the forehead and face, and even pale or flushing of the face. Now, there are two types of cluster headaches. The first type is something called episodic cluster headache. Now, this accounts to roughly 80% of all cluster headaches. Sufferers will have attacks with bouts of clustered periods which can last weeks or months, followed by pain-free periods called remission periods, which can last 2 months or years. They are often occur seasonally and at set times during the year. On the other hand, chronic cluster headaches accounts to roughly 20% of all cluster headaches. Now, sufferers will have attacks lasting for a year or more without remission periods. Some may have periods of headache-free days, however, these remission periods last less than 1 month. So it is quite chronic and severe in nature. Let's now discuss what risk factors are for cluster headaches. The risk factor is firstly men. Men are 5 to 6 times more common to have that than females. Another risk factor are smokers. Sufferers can usually be a heavy smoker or their parents are smokers. Alcohol is another risk factor. Significant alcohol consumption can cause it. And the average age is between 20 to 50 years old. However, this condition can be developed in all age brackets. Another risk factor is family history. Having a family member with cluster headaches may also increase your risk of having cluster headaches. So, what is the cause of cluster headache? Recent research has shown that a common cause is due to a sensitized brainstem. Now, the brainstem is located below the brain and is located in the upper 3 cervical spine of the neck. The brainstem houses a nerve called the trigeminal cervical nucleus. Now this can innervate all the way up into the eye where cluster headaches receive the pain. If that nerve or if the brainstem is hypersensitive and overactive, it can easily contribute and create cluster headache symptoms and cluster headache pain. So what we would recommend is that you do seek a professional who deals with chronic headaches and migraines, and more importantly, cluster headaches. If you do suffer from cluster headaches, then email us or even call us on 1-800-HEADACHE to understand what treatment options there are available. Just remember, cluster headaches is treatable and can be managed quite well. My name is Bertrand Dirk, and hopefully you have a better understanding of what cluster headaches are. Thank you.